Welcome to Veterans Health Watch. I'm Kenya Griffin. By now, most of us are aware of the global opioid epidemic. Drug overdose deaths are the leading cause of injury-related deaths in the U.S., and most of them are caused by opioids. Now we're in a fight to save lives. And here to help us is Dr. Kelly Kang. Dr. Kang, thank you so much for joining us.
Thank you for having me.
First, how did we get here where opioids is such a problem?
So the opioid epidemic started in the late 1990s due to a couple different factors. Pharmaceutical companies were reassuring physicians that opioids were safe and okay to prescribe, not addictive. And then eventually pain became a fifth vital sign, which we were encouraged to treat. And so that led to overprescribing of opioids and eventually led us to where we are today. Now we realize that opioids they do carry significant risks and they are addictive. And so we're kind of trying to resolve that issue.
And some people have started on opioids. Most people started opioids through a prescription, totally legal way of obtaining it. Then they become addicted and they start seeking it in other ways. Could you help us to understand why it's not safe to purchase opioids on the streets?
Well, on the streets, opioids they're not regulated. You don't really know exactly what dose you're getting. You don't really know exactly what medication you're getting. And so that leads to a whole variety of issues. The other part is that some of them are contaminated with a drug called fentanyl, which is very potent and just a little bit can cause overdose, deaths, and other severe effects.
Yeah, I've been seeing signs walking down the streets and just anywhere. I've been seeing signs that says fentanyl is here and slow down, things like that. So now we're talking about naloxone and something to help because people are overdosing. They're buying these things on the streets. They're using other medication. Tell us about naloxone and how it works.
So naloxone is a life-saving medication that's used to reverse opioid overdoses or suspected overdoses. And so I brought a demonstration with us today. You can take that one if you want to take a look. So the naloxone is a nasal spray. Narcan is the brand name for it. There are a couple different formulations, but this is the easiest way to use Narcan. And so in each kit, you have 2 of these nasal spray devices. And so what you would do is you would open the package, and this is the nasal spray. And so what you would want to do is when you recognize signs of an opioid overdose, which include bluish or gray lips, clammy skin, pinpoint pupils, or if the person's not responsive to stimulation, or you can take your fist and rub it against the person's chest to do a sternal rub. If they're not responding, then administer naloxone. And so what you would do is you would insert this into the person's nostril.
Yeah, it's like it reminds me if you have sinus problems, it looks like one of those, the sinus medication. Okay.
Yeah, so just kind of like a nasal spray, you put it into the nostril and you push it all the way in. And so that's what one dose would look like. It's important not to prime this nasal spray, which
what do you mean by prime it?
So priming, with some inhalers and things, we counsel patients to have a spray, do a spray the first time to make sure that medication's coming out. But there's only one dose in here, so we want to make sure to not prime this medication. So once that's administered, make sure to call 911.
I was going to ask that. So once you administer it, and the person is, if they're unconscious or non-responsive, they're not inhaling. So how does it work?
So this is actually absorbed through the nasal passage. It doesn't have to be while the person is breathing. It's not inhaled. It's more absorbed.
And so you've administered this, your loved one is there. How do you know that it's working?
So you want to watch for signs of a response. And if the person is not responding after 2 to 3 minutes, go ahead and administer the second kit.
But in the meantime, should you call 911?
Yes, so 911 should be called. And one of the most important reasons is that Narcan only lasts in the body between 30 to 90 minutes, but opioids can last in the body from 4 to 6 hours. And so it can wear off and the person can actually overdose again if they don't have medical treatment.
Okay, so even if you're using this, call 911. And we want to be honest, it's out here. The epidemic is happening. People are using the medication, be it prescribed or on the streets. So we don't want people to be shy about asking for this. If you know your loved one is using opioids, some form of opioids, or if you yourself are using it, how do you, as a veteran, how can you get this?
So as a veteran at our VA Maryland, so we make it easy for veterans to get it. So they can talk to their healthcare provider. As long as they receive counseling on opioid overdose symptoms and how to use naloxone, they can actually go to the pharmacy and receive a naloxone prescription if it's their first time receiving naloxone.
And does it only work on, what happens if the person, you think they've overdosed, or you can see that they've overdosed, and maybe it wasn't an opioid, maybe it was something else, and you've used a naloxone? Should you be concerned?
That's a great question. So naloxone doesn't do anything if the person doesn't have opioids in their system. And so we say at worst, naloxone will do nothing, but at best, it can save a life. Mm-hmm. And so even if the person is unsure whether the person is overdosing on opioids or not, go ahead and administer it.
And having this available, we want to make sure if the time comes, that it's there, it's handy. How do you teach people how to have this handy and ready, and how to help their families or their loved ones?
Yeah, so we want to, ideally, we would love to have, if a family member or a loved one or a caregiver was present at the time of counseling for naloxone so that they know how to use it as well. But if that's not possible, we have a lot of education materials for the veterans. They can bring this home with them, share it with their family members, let them know where they keep the naloxone, and also how to use the naloxone, as well as recognizing symptoms of opioid overdose.
And again, we want people to know that this epidemic is here, that people are overdosing. Let's be honest about it and make sure we can save lives and have something like this handy. But then we know that people they're turning to the streets, they're purchasing things. So we want people to be educated about that too, and the dangers of fentanyl and those street drugs. So tell us a little bit more about that.
Yeah, so with fentanyl, actually there are quite a few veterans and patients that we've encountered where we're seeing positive fentanyl urine drug screens, and they had no idea that it was in their system. And so they're shocked and surprised when they find out about it in their system. And so that's a huge risk because, like I said earlier, it's very potent, 50 to 100 times more potent than morphine. And so it carries a huge risk for overdose. And so if somebody gets opioids, make sure to do it through a prescriber, through a pharmacy where it's
So basically, you never know what you're getting out there.
Exactly.
It can be more dangerous than you could ever imagine.
Exactly.
You mentioned earlier that this opioid crisis started through prescriptions. Someone went to see their doctor, they had an issue, pain, or whatever the cause was, and they started using a prescription safely, not seeking anything. So I'm sure they became addicted, and now there's this stigma associated with addiction. How can we help those veterans?
Yeah, that's a great question. So there is a stigma, associated with overdose, with the term overdose, naloxone, opioid use disorder. And so for some people, there's this kind of shame associated with that when they had been taking opioids the way it was prescribed, but over time it had developed into an opioid use disorder. And what we've seen is that with patients who are on long-term opioid therapy, about 40% of them can go on to develop opioid use disorder, according to one study.
And so for those veterans, how should they ask for this help?
So they can go to their primary care provider and ask for a referral, or they can also go to a mental health provider.
And how do you know if you're addicted, if you have this disorder?
So things like always thinking about getting opioids, if they are waiting for their next dose, if they're continuing to use opioids, but it's affecting their social life, or it's affecting their work life, but they're continuing to use it despite those problems. Or if they notice that they want to taper off the opioids, but they can't. And so these are all signs that they may have opioid use disorder, and that would be a great time to be open and honest with their provider to talk about that.
And that's the point we really want to make, be open and honest. There's unsafe things out in the streets. It's a real problem. We have this naloxone to help. We have treatment to help. So just be honest and come and look for that help.
Yep.
Thank you so much.
Yeah, you're welcome.
You know, when I came back from Vietnam, and with all the veterans I knew, most of us knew nothing about the term PTSD. 10 years ago, I came into the VA and I got a mental health evaluation. I started getting counseling in group therapy and individual therapy. My advice to a veteran is don't wait until you're totally in crisis. Go into the VA, seek the assistance of those who can help you, just like they helped me. I'm a veteran. I choose VA. I choose VA.
The most important thing you need to know about the flu is how to prevent it. And that means getting the flu shot every year. But some people still don't get it. Here to help us is Sherry Kraska. Sherry, thank you so much for joining us. Help us out a little bit. Why should people get the flu shot?
The single most important reason for you not to get the flu is to get the flu shot. Hand washing is also really important, but if you don't want to get the flu, you need the flu shot.
And we hear people saying, I get sick from the flu shot, or I get the flu from the flu shot. Is that true?
No, you can't get the flu from a flu shot. You may have a reaction. Some people feel a little bit more tired. They might have a little bit of nausea. They may have a little bit of body aches. But you're not going to get the flu from a flu shot. It's a dead virus. There's nothing live in the flu shots. In either one of the doses that we give here, you can't get the flu from a flu shot.
And what are you seeing so far? Every year seems to be different. The flu seems to be a little different so far, different each year. What are you seeing this year?
Well, we've had a couple of people in the last 2 weeks that have actually come into the ED with positive flu, and they have felt horrible. So it appears as though this could be a bad season. You never really know until you have about 30 days when the flu season actually starts, and that usually starts from September 15th. So it will be really hard to tell, but they're anticipating that this could be a bad year.
So get the flu shot.
Absolutely.
And what about those people who have loved ones who are in the hospital? You want to come visit, but you're not feeling well. What advice do you give to?
You should never visit anybody in the hospital if you yourself are not feeling well, because there's always these bugs in the hospital that are already there. If you're not feeling well and you come in, you could get something that you wouldn't want to have. And anybody that's in the hospital, we don't want them to get any sicker than they already are.
So if you're not feeling well, just give your loved one a call.
And stay home.
Stay home.
Till you're feeling well.
Absolutely. And with the flu shot, for our veterans who are enrolled in the system, how can they get it?
They can get the flu shot at any of the outpatient clinics throughout the entire VA Maryland healthcare system, any of the CBOCs included. We also offer it to all patients who are inpatients at any one of our facilities. And then we have the flu clinic here that we do on the second floor on the balcony that runs every day, Monday through Friday, except for federal holidays, from 8:30 to 3 o'clock. And they can get the regular dose or the higher dose, which is for folks that are over 65 or who may be immunocompromised. Okay. So we offer both of those here.
And what about in the community? If you can't make it into...
If you can't make it in here, there are lots of places, Walgreens, Walmart, Rite Aid, CVS. They all offer the flu shot. But we do have a national partnership with Walgreens, and any veteran can go to a Walgreens and present their VA ID card and another form of ID, and they can get the standard dose of the flu shot at no cost.
Okay, great, at no cost. And the flu shots that they get here at the VA are no cost. Awesome. And they can also do it if they have a scheduled appointment, correct?
They can do it during their regularly scheduled appointment, and as I said, we also offer it to inpatients.
Great, great. And then, just so people can be clear, what are some of the symptoms of the flu?
Usually people have a fever. It's usually not a high fever. They usually have body aches, muscle aches, headache. They might feel a little nauseous. Usually you don't have vomiting with the flu. It's usually nausea. I hear a lot of people, actually one of my employees that called and said, I think I have the flu and I feel like a train hit me. So the first couple of days you feel pretty miserable.
Yeah, that body ache, anything that touches your skin hurts if you have the flu.
Absolutely.
So would you rather be a little achy, a little sick from a little shot, or really sick? And the flu, it can be quite deadly, isn't it?
It can be. There's usually between 200,000 people that usually get the flu, and it's often very deadly for folks that already aren't real healthy and for the very young. So you need to be very careful. I mean, every year we hear about the very young and the elderly or people with conditions that die from the flu. So it can be very serious.
So get the flu shot.
Absolutely.
Don't wait for those symptoms.
Absolutely.
Once the symptoms kick in, is there anything you can do, or you just wait for the virus to pass?
There is a drug that you can take that is available, but you usually need to get that drug within about 24 hours after you start to get the symptoms, because if not, it really isn't going to help you. It's really not going to stop you from feeling miserable. And a lot of primary care offices, physicians, already tell their patients when the flu season is coming up, if you have the flu, please don't come in. Stay at home.
So bottom line, get the flu shot.
Get the flu shot.
Great. Thank you so much for joining us.
Sure.
If you've experienced depression or you're looking for a way to improve your mood, the Mood Coach app can help. Mood Coach is based on behavioral activation, which is a non-medication intervention for depressed mood. It helps you to participate in pleasurable activities and connect more with important people in your life. Participating in activities that are consistent with your values can help you feel better by reducing negative feelings that can come with depression or post-traumatic stress disorder, PTSD. When you launch Mood Coach, you'll be guided to set up a one-week plan. To do this, you'll select a start date, values, and activity levels for each value. Let's get started. First, select when you want to put your plan into action. The default setting is today, but you can change that. Next, you'll be prompted to select 6 value areas that you'd like to work on. Values can include family relationships, mental and physical health, career and employment, and more. When you select a value, you'll be asked to choose an activity level for the value. If you choose easy, you'll schedule 1 activity this week. If advanced, you'll schedule 5 or more. You can change the types of values and number of activities each week when you set your plan. Once you choose all 6 values, you're ready to begin. To put your plan into action, you'll add activities to support each of your values. To get started, choose activities that are simple and easy to do. The first time you add an activity, you'll be asked to rate it in terms of how fun, difficult, and important it is to you. For each activity you complete, you earn points based on those ratings. You can set a reminder on the app so you don't forget to practice during the week. Schedule activities to support each of your values. You can also create your own activity, rate it, and add it to your plan. When you finished adding activities, you have a plan for the week. Each time you complete a scheduled activity that supports your values, tap I completed this activity. When the week is over, view your plan history. You can challenge yourself to earn more points next week by completing more activities or activities with higher points. Use the Rate My Mood tool in the app to record how you're feeling each day, or multiple times a day. This tool uses a simple rating system of 0 to 10. Use the Mood Rating History tool to monitor your moods and see how they change over time. Use the Assess My Symptoms tool to assess and track your symptoms of depression. Answer questions about how you've been feeling over the past 2 weeks, including today. You'll receive feedback based on your answers. Use the assessment history to view and track your progress over time. You can also set a reminder to take the assessment again. In the Learn section of the app, you will find short readings that can help you better understand depression and PTSD. You can also learn about behavioral activation, values, and how goal-based action works to help you feel better. In the Get Support section of the app, you can connect to crisis resources and locate a mental health care provider. In My Support Network, you can add names and contact information for people you trust. Reach out to your support network when you need help. By prompting you to participate in enjoyable activities and connect with important people, Mood Coach can help lessen the symptoms of depression and PTSD. Download Mood Coach today.
The VA has joined the nation. Our facilities are smoke-free. This move furthers our commitment to provide a safe and healthy environment for our patients, our visitors, volunteers, and employees. If you need help kicking the habit, talk to your primary care team or visit smokefree.gov. Help us clear the air.
My name is Rebecca. I struggled with depression for years. I thought I needed cigarettes to cope. But then I started losing my teeth. That was a wake-up call. I was able to quit smoking, and then I started running. Now I feel a lot better about where I'm going. My tip is, when life gives you a wake-up call, answer it.
Call 1-855-QUIT-VET.
Smoking gave me COPD, which makes it harder and harder for me to breathe. I have a tip for you. If your doctor gives you 5 years to live, spend it talking with your grandchildren. Explain to them that your grandpa's not going to be around anymore to share his wisdom and his love. I haven't figured out how to do that yet. And I'm running out of time.
Call 1-855-QUIT-VET.
I got into service in 1980 in the United States Air Force. I was in the Army, military police, sergeant.
Staff Sergeant, United States Air Force, and I'm retired.
I was in the military for a combined total of about 11 and a half years.
I was an ammunition weapons specialist.
I joined the United States Marine Corps in February of 1974.
I was United States Army. My specialty was a 63 Bravo light wheel vehicle mechanic.
It was 50 pounds of HME, and it blew up right next to my truck, almost within a foot of where I was sitting. I had heart issues. I had cardiovascular disease.
And they said, yes, you have a severe hearing loss in your ear.
I was in a helicopter crash in central Afghanistan, which paralyzed me from the chest down.
And in 2005, I had my first heart attack of 3.
And someone said, well, you were in the military, you can go to the VA.
It took a lot of courage for me to admit to myself that I needed help.
My thoughts about the VA prior to me using it were pretty much non-existent. Never in a million years did I ever think that I would be using it to the extent that I am today.
I knew that the Veterans Hospital was supposed to be there to help me and to assist me.
Years ago, I would not have gone to the VA because the VA had a very bad reputation. There's been a transformation in what the VA should do for the people who serve their country, and it's made a huge difference.
Integrity means that you take your job seriously, that you really care about the veteran, that you're not just there getting a paycheck, that you really like what you do and you really care.
The integrity that each doctor carries with them as far as wanting to get the job done correctly, it's refreshing. If you as a provider can go one-on-one and they listen to what you're saying because they have the trust in you, it makes a difference.
Commitment. I learned that in the military. At 17 years old, at 18 years old, commitment, you follow through. So when I go to the VA and my doctor says he's going to do something, I don't have to wonder if it's gonna happen.
Hi, Jamil.
We have various clinics like mental health clinic, GI clinic, eye clinic, a dental clinic. They're all committed to provide the very best care to the veterans who come.
Any problems that you have, they will listen to you. And if there's something that they can do, they'll do it.
My doctors, they since day one have been committed to getting me the things that I need, to making sure that my needs are met, to make sure that I'm getting the medications that I'm doing.
They are very much an advocate, not just for me, but I think all veterans.
It is very important to have an advocate inside the VA system. They strive to get you the things that you need.
I actually have a patient advocate on speed dial. She's almost family. First day I was in at the hospital, she came and saw me, and she's amazing.
I love the fact that whenever I ask a question of them, they're willing to give me that little bit of education.
Treating you with respect. That was missing before as a veteran. You were not getting the respect.
All the nurses and doctors, what they deliver, it's about respect. They treat you like you're a patient, but it goes beyond being patient. It's just like being a friend.
They respect the patients and who comes in because they realize they're people too.
When I do tell them, hey, I am a United States Marine, I did serve my 4 years, they respect that I went in to protect their freedoms.
Excellence is a level of competence that we all try to achieve. And the measure of it is how we achieve it and what we perform.
Thank you, sir.
I see the kinds of things that the VA is doing to make the VA better. Everything from their inspection scores to the improvements around the hospital, they're striving to reach excellence every day.
Not only is this a good system, but they pay attention. And I am a vet, and I'm special in that arena. And I fell in love with the system.
It's something I would recommend to everybody is a vet, no matter what you are, no matter what era. It's worth it.
I'm very grateful that there's a VA medical center in any place that you can have the privilege to go to take care of yourself.
I feel that camaraderie when I walk through the doors, and I just feel like I'm part of something.
It's about treating you the right way, the way that I, as a veteran, want.
The VA has been good for me. They're still taking care of me to this day, and it works.
They're a top facility. Patient care, equipment, attitudes, treatment, this is just all top shelf. You're not a number, you're a person, and they care.
Someone asked me, why are you going to the VA? I said, I'm telling you, it's changed. I chose to go to the VA because when I went there, the service and the honesty that the people gave me, the treatment, was just fantastic. And if I'm getting good service with good people who care, I'm gonna do that.
This wraps up this edition of Veterans Health Watch. If you're a veteran, apply for VA healthcare today. You deserve it. Just visit our webpage for more information. You can find more episodes of Veterans Health Watch on our YouTube channel. Just type in VA Maryland Healthcare System in the search bar. And be sure to hit the subscribe button to get notifications of new videos. Don't worry, it's free. We'll see you on the next Veterans Health Watch.